This week on the Ascent Health, we are talking about gut health with Dr. Bree. She is a naturopath. She's answering all my questions on all your questions about what is gut health, why does it matter, what are food sensitivity tests. I had some fun food sensitivity tests, and we talk about those and look at the results. What we each can do to help our own gut health, our supplements worth it? Should we all be taking probiotics? All of those things. So let's dive in. Welcome to On the Ascent Health. I am here with Dr. Bree. So welcome to the show.
Thank you for having me, Laura. Hi, my name is Dr. Breana Hauskins. I am a naturopathic doctor licensed here in Alaska and in Montana.
And so, what is a naturopath? How does that differ from an MD, DO? What are you?
What am I? So, a naturopathic doctor is licensed as a primary care provider. And in my practice, I specialize or focus on, thyroid conditions, women's hormones, gut health, sleep conditions. And so, how is a naturopath different from MDs, DOs? Is we have over 40 hours of clinical training in nutritional aspects, everything digestive, functional nutrition, what to eat, what not to eat, as well as training in herbal remedies, homeopathic remedies, and other natural remedies, which there are many different ones. We also get training in naturopathic manipulative therapies,
Well, I didn't know
um,
that.
which was
Okay.
not one of my strong skills in med school. So this is why I don't focus on that and instead refer to people like yourself, Laura.
Okay. So, when was naturopathy founded?
It goes back, to over 100 years. Naturopathic medicine has been in the US for over 100 years. When you look at some European traditions, they go back several hundred years. I attended the National University of Naturopathic Medicine in Portland, Oregon, which is the oldest accredited naturopathic medical school in the US. There's also schools in Seattle. There's a couple of schools in Canada. So there's not a lot of us around. Our medicine has been around a very long time.
Right. Very cool. Okay, so today we are talking about gut health, which I feel like is a very hot topic in the world, right? I talk about at least the gut brain connection. It's huge, right? We're finding more and more evidence about that, or research is happening about it. So, what is gut health? What does the typical American gut look like?
Well, there's several different ways to look at that. So gut health is not only what you're eating, it's how the components of your gut are working, your stomach acid to help us break down different foods, digestive enzymes coming from your pancreas, insulin as it's needing to participate in the equation to help absorb glucose from the foods that you eat. And then we think about things like motility, how quickly or slowly your food moves from your mouth to exiting your body. And we looked at the absorptive surfaces of the small intestine. That is the main function of our small intestine, is to absorb fluids, absorb, nutrients, absorb vitamins, minerals, different nutritional components. So with our gut, there's a lot of functions happening. And then we can also think about, infections in our gut. We've probably all the stomach bug or the
Right.
24-hour flu where we're vomiting and maybe having diarrhea, abdominal pain. You travel to Mexico and bring home
Norovirus. Yeah.
norovirus. Absolutely. So our gut is really, really important. And then there's this whole other component of our gut that we are still continuing learning about. It's the gut microbiome. It's a big fancy word for all the beneficial little tiny organisms that live in our gut and work synergistically with our body, our digestive enzymes, the foods that we eat. So that microbiome, we're getting really so much more data and understanding about how that works with us, because those bacteria, those organisms, because it's not just bacteria that are in our gut that are beneficial, but those organisms have evolved with us for thousands of years. So fun fact, our human body has about 1 trillion cells. We have about 3 trillion cells of beneficial organisms on our body and inside our
Because
body.
they're smaller than your other cells. That's why we can have more of them, but they're not like taking us over.
Right, they're not
Right. I was
taking
wondering
us
if you knew
over.
that stat. I knew it was like
I do.
huge,
Yeah,
which
that
is
is
crazy.
it's a fun fact.
And we're born with them.
Yes, so essentially when we're born, we are sterile. And as we transition through a vaginal birth and with breastfeeding,
Right.
so Babies pick up beneficial microbes passing through the vaginal canal
Right.
because healthy women have a number of different beneficial bacteria.
Let's talk some about C-section babies.
Well, we will talk
Those
about that as
those are my
well.
kids are too.
Absolutely. And then when moms are breastfeeding, that skin contact that infants are picking up beneficial bacteria through, latching to the breast to nurse. So C-section babies, we have discovered that there are beneficial bacterial strains that when a baby is born via C-section and not through the vaginal canal, is that they can benefit from supplementation. Or we see formulas now that are adding beneficial bacteria to, milk formulas, formulas, if you will, that babies are given if moms choose not to breastfeed or can't breastfeed for other reasons. So we are really understanding more the benefits of healthy moms having good microbiome levels throughout their body so that we can give our babies what they need to start being healthy as well. So if you've had a C-section, if you haven't breastfed, or I've known lots of moms who pump milk, express milk, and feed via bottle because that works best for their family and their kiddos. And we can add probiotics to those things. So as our kids age, eat fermented foods. How many kids spend time on the floor, consuming dirt?
I let my kids do that.
Dirt has beneficial microbes as well. So, it's not all lost if your kid was born via C-section or didn't latch to the breast for breastfeeding.
Right. So there's none of it happens like in utero. They don't get any of it.
No,
All
that
as soon
does
as they
not
okay.
cross through the placenta, and it's picked up as they're literally coming out.
Interesting.
Mhm.
Okay. So, right, we talked about the standard American diet, the typical American diet, not great. What does that do to our gut?
So the standard American diet is typically pretty dominant in simple carbohydrates or refined carbohydrates. We hear lots of terms like keto diets and low carb, the carnivore diet. Really what those are doing is reducing the refined carbohydrates. Carbohydrates in general are incredibly beneficial when they're eaten in proper proportions and in their kind of whole food state. Potatoes aren't a bad thing until they become potato chips, French fries. Wheat's not a bad thing unless you have, allergies to that or other conditions. But whole wheat provides benefits because of the fiber. So when we think about the standard American diet, it's dominant in processed carbohydrates that are low in fiber, high in sugar. They don't have to have added sugar per se, but that removal of the fiber provides that the starch, the carbohydrates of those vegetables, are really easy and quickly digested. When we have a high refined carbohydrate diet, that feeds inappropriate bacteria overgrowth. It creates a lot of inflammation for people in their gut as well as all throughout their body, joints, skin, and it affects our glucose and insulin balance. So that also contributes to inappropriate balance of those components, which then oftentimes leads people down a path of weight gain, difficult weight loss. When we have those high carbohydrates, it also feeds bacteria that are not beneficial. So we talked about the beneficial bacteria. We want the good guys and we want to crowd out the bad guys within our intestines specifically. So our standard American diet is also high in bad fats and low in good fats. Here in Alaska, we have an advantage of we get to eat salmon.
Yeah.
We get to eat seafood that has a lot of good beneficial fats. Those are very, very helpful for our bodies to keep our gut in a good balance and also the rest of our body. Our brains love our fats, our skin, things like that.
So when people go, do you need some carbohydrates? If somebody goes on a keto diet, does that disrupt or destroy some of the good bacteria as well?
It absolutely can, but on a keto diet, there are very keto friendly. We see a lot things with like cauliflower or sweet potatoes and yams. So those beneficial vegetables with the fiber, the low starch content, you can be on a ketogenic diet and still consume carbs. But we want to choose the right types of carbs. There's something called resistant starch, which is found in green bananas, certain types of beans, boiled potatoes versus baked potatoes.
Right. And isn't it like noodles once they get cold or rice once they get cold?
Yes, the starches. Yes, absolutely. So those resistant starches don't feed inappropriate bacterial balance. They don't affect our glucose and our insulin to spike those levels and can create, instabilities in blood sugar. So ketogenic diets, you can absolutely have carbohydrates. You have to choose the right type.
How about carnivore diets? What do they do to the microbiome? Do we know
Carnivore,
yet?
I feel like that's still emerging. I feel like carnivore is the latest version of the Atkins diet. The Atkins diet was something that was happening in the 90s. That was, eat lots of meat, dairy products, eggs. When we think about the carnivore diet, many of my patients don't have enough stomach acid to help break down the meats.
That makes sense.
And then they struggle to produce enough of the pancreatic juices to help further break down those foods. And the carnivore diet really depends on how you're cooking your meats. Ideally, we're cooking meats in a slow, low temperature type of cooking, like crock pot or roasting things in your Dutch oven. We're not, grilling at high heats or putting things in your fry pan and grilling them quickly or cooking them quickly at a high temperature, because that also creates a lot more inflammatory products in those meat products. So I'm not saying the carnivore diet is ill-advised. You have to have the right context of what are the meats that you're eating, how are you cooking them, and what other nutrients are you balancing with the high protein.
Very interesting. And how about like all of the like processed foods? You talk about the simple carbs, like the chemicals, the preservatives. What do those do to our gut?
Well, that
Do we know?
a lot of it is very synergistic, interrelated. So we've got this glucose spike, insulin imbalances when we're having those high refined carbohydrate intakes. And then when we add chemicals, flavoring agents, food colorings,
Right.
preservatives, agricultural chemicals that are sprayed on corn and soybeans and just, pretty much everything that we consume that's non-organic, that becomes a big mixing pot of materials that our body has to process. They have to break them down if they can. So either the gut has to break them down or your liver and your kidneys have to process those chemicals. So it just adds to the overall burden and the energy consumption that those organ systems require to process the foods that you're eating. So even if that food is somewhat easily digestible, on the backside, your liver and your kidneys are taking on the burden of breaking down those chemicals. And it just adds to the overall energy consumption, kind of reducing our energy to be available for other things that we want to do in our life, like working out or reading books or cleaning our house. So it becomes a challenge for lots of people when their diets are dominated by all of those additional food chemicals, agricultural chemicals.
And then how do you work with people? Are you doing like food testing or diet changes, medication? What is like your approach as a naturopath?
All of those things. I am a huge advocate of test, don't guess. When I've got something going on with a patient, I am a huge fan of blood testing to look at foods, what foods are problematic for that person. I might do a food allergy test with blood, looking at certain immune proteins. I might do a food inflammation test. That's one of my favorite ones to do because it also includes testing for non-food substances like food dyes, preservatives, caffeine. I can even test for things like ibuprofen or acetaminophen if someone's got an inflammatory reaction to those. And those are all done by blood. So it gives me a data set that says, hey, here's your results. These are the things that we need to eliminate and avoid. These are the things that you can eat freely, abundantly, without any restrictions. So it not only gives me a list of what not to do, it gives me a list of what to do for that particular patient. I'm also a huge fan of stool tests. There are some really awesome stool tests out there. We're really understanding that microbiome within our intestines so much more. We're looking at types of beneficial bacteria that should be a appropriate proportion within our gut. We're looking for bad bacteria, viruses, parasites, worms, yeast or fungal overgrowth. And those stool tests also give us a functional aspect of digestion. Do you have enough pancreatic digestion enzymes? Do we have markers for inflammatory bowel disease or IBS? Do we have markers for leaky gut? That's kind of a catchphrase these days, or, a hot item that people are talking about, leaky gut. As naturopaths, we've been talking about that for decades. So stool tests are awesome. Blood tests are awesome. Definitely doing diet analysis, I ask people, what do you eat? The two questions I ask folks are, what time do you eat your first meal of the day?
Right.
And what do you eat? And then I'll say, when do you eat again? And what do you eat? So I look at how long is someone fasting? Are they having bedtime snacks at, 9 or 10 o'clock? And then they're eating their next meal at 6 or 7 in the morning? They're not getting enough time for fasting so that the body can break down all of the foods that they've eaten and have time to give our digestion tract a rest, that it's not, we're not asking it to work so hard all the time. So I definitely ask people about their diets. I ask people about their caffeine consumption. What's your favorite caffeine source? We
Right.
hear a lot about energy drinks. Some are better than others.
Which are the better ones?
I'm still on the search
You're
for
still on
that
that,
of,
okay. Yeah, me too.
a lot of times I think about which ones are the least bad versus
Sure.
which ones are
Right.
more problematic, given, again, artificial flavorings, coloring
Mhm.
agents, preservatives, how much caffeine is in those different drinks. I ask people about their water intake. What's their hydration like? What's their alcohol consumption like? So all of those things are very, very important for me to give a patient the most comprehensive plan that I can.
Why do people have food allergies, food insensitivity, or food sensitivities, hormones, leaky gut, like all of the above? Why is it that like somebody might react to? We'll do my results in a little bit, like spinach or something like that.
Yeah, something that you think, oh, that's a superfood,
That's
but
yeah,
it's
so
not
healthy.
super for you.
Right.
So there's lots of different reasons that people have reactions to food and have gut problems. There might be a genetic component. I personally have celiac disease. My kids have celiac disease, which is an autoimmune condition reacting to wheat and gluten. My husband's side of the family has a pretty dominant family history. So that makes sense, that my kids are having that because they're getting some of that genetic component. So there
Mhm.
could be genetic reasons, like for other autoimmune conditions, Crohn's disease, ulcerative colitis, family histories. So we think about that. We think about just general stressors. Can we just talk about, the COVID pandemic and how stressful that was for so many, many people, in the US and worldwide. So stressors could be, I don't like my job, struggle financially.
And your
Absolutely.
food
Stress,
sensitivity.
adrenal hormones affect our gut. When we have stress hormones that are coursing through our bodies
Right.
on a day-to-day basis, that will absolutely dampen or turn the volume down on your immune system, which
Mhm.
then makes the immune system within our gut be more reactive to things. So stress, immune system, they are definitely, dare I say, the yin and yang kind of oppositional partners. They don't work in synergy, they work in opposition. We talk about what we eat, the standard American diet. Our diets are nutritionally depleted. We don't have the vitamin and mineral content in our diet like we used to. People don't have time to raise their own, fruits and vegetables. They don't
Right.
have gardens like we did 100 years ago, 200 years ago. People are, when we think about industrial agriculture, the agricultural chemicals that are applied to our
Mhm.
fruits and vegetables, things that are sprayed, that affects our bodies and struggling to have our gut function the way it should. We think about how animals are raised, chicken, beef, pork, and the different things that those animals are given also affects our bodies. Interestingly enough, in the world of industrial raised beef, so cows, they are given antibiotics because of their living conditions. They're not
Right.
allowed, they are stacked in small spaces, and that causes stress on that animal. And of course, then they have infections that they pass, to each other. So they're given antibiotics to lessen the infections that they're exposed to, which then, of course, those antibiotic residues are in the meat of the products that we eat. And I don't have the answers for how to change our agricultural
Right.
approaches.
Right.
That is outside
Exactly.
my scope,
And make it affordable, et
and make it
cetera.
affordable. So these are all factoring in. And then we also have things like long-term use of acid suppressing medications. That's part of it. We have antibiotics that people need to take for sinus infections, bladder infections, throat infections. That factors into our gut. And finally, kind of one more caveat is many people do not consume fermented foods. We can go back to like sauerkraut
Right.
or fermented dairy products. That has been historically something that many cultures have done for, years and years and years. In many places today in our lives, we don't consume fermented foods and we don't get those beneficial microbes through the fermentation process of those different foods. Like I said, sauerkraut,
Right.
kefir,
Kombucha.
kombucha.
My kids love it. So that's what we probably have
Absolutely.
the most fermented.
We think about things like miso, which is a fermented soy
Hmm.
product. We think about tofu as a fermented soy product. We think about, other fermented vegetables, just sauerkraut, fermented cabbage,
Right.
and ferment asparagus and green beans and beets. We don't eat those things routinely like people did 100, 200, 500 years ago.
Right. And even our yogurts, which are fermented, some of them have live cultures
Yep.
and some of them don't.
And some of them don't. And yogurt is one of those things that actually has more sugar than you think it should
So
be.
many of them do.
Yeah.
Right.
So, we just don't, we're not eating and replenishing our microbiome like people did historically.
Okay, back to food sensitivity tests. Seems like a lot of us have food sensitivities these days.
Yes.
I went ahead and ordered one of my own this summer. Probably not recommended. You probably people should have somebody guide them through it so that they can.
Absolutely. It's difficult
Otherwise,
sometimes to interpret these results. And
they can be
I
overwhelming,
They can be
right?
super overwhelming. I like to level up and call them food allergies because what
Okay,
we're really looking at is an immune protein called an immunoglobulin. So most people have probably heard of folks that have to have an EpiPen because
right.
they have a life-threatening food allergy or even like to a bee sting, but we're talking about food today. The immunoglobulin that is factoring into life-threatening food allergies is called IgE. I always think emergency EpiPen. So when someone consumes that product, their immune system is reacting incredibly quickly
Okay,
to create inflammation. And this is where people have, their throat is closing up.
right.
They're struggling to breathe. They might have hives on their skin, welts on their skin.
Hmm.
It is a life-threatening emergency. That is not the kind of test that we're talking about.
Okay.
We are talking
People usually
about
know if they have
people
those, right?
usually know if they have that. And, big common offenders are, peanuts,
Right.
shellfish, dairy products. I've had patients that have soy or corn.
Mm.
Those are the big ones. But we're talking about an immune protein or immunoglobulin known as IgG. So if IgE is our emergency, something that happens rapidly, IgG might happen within 5 to 10 minutes after consuming a food,
Okay.
but it's not life threatening. It might happen also up to 3 days after consuming the food. So sometimes it's a very, very slow increase in that IgG production. And when we think about the IgG, these foods and these substances are irritating to people. It might cause digestive distress, gas, bloating, bowel
Mhm.
changes, abdominal pain, cramping, nausea, vomiting. But it also might show up as changes in your skin rashes, itching, acne, eczema. It might show up as headaches. It might show up as a change in someone's blood pressure, a blood pressure drop, a blood pressure increase.
Interesting.
It might show up as joint pain. So it's difficult to know if your gut is reacting and having a non-gut symptom or if you're having a gut symptom. But IgG is a very, very useful type of test. And when we look at your
Yeah.
results,
Is it usually a blood test? Is that how
it's
you do it?
usually,
Okay.
yes, I've only ever done it as a blood test. There's a company that I use, and I've worked with this company for probably 25 years. And it's an easy test. The test kit that I do with patients, it's a finger poke that they
Okay.
can do at
That's
home, easy to collect. Given that, yes, you have to poke your own finger,
Mhm.
but it can be done from the comfort of your own home. We do see some food testing via stools, but it's very limited. We don't see a lot of food panels. Like for this panel that you had done, how many foods were tested on this? Do you recall?
I think 122.
Awesome.
Yeah.
One of my most favorite panels is 144. So this covers a lot of the
Right.
big ones that are people that are eating, regularly.
Mhm.
So when we think about the IG production, we're looking at no production in response to a food, low production, medium production, or high production. And this testing method, the laboratories basically, I'll kind of simplify the process of how this testing is done. They take your blood sample. They then take the food extract and they're essentially kind of shining a light through what level of resistance your food and your immune or the food in your immune system have. So if there's a lot of resistance, that would be called a high level
Okay.
reaction. If there's less resistance or no resistance, of course, that's lower on the spectrum. So I'll let you share
Yeah,
your
yeah. So
results.
my level 4 reactions that we call them are spirulina and shrimp. And I did have a greens drink that had spirulina that I was consuming regularly. Shrimp I have maybe twice a year.
Right. So shrimp is
So
not as a food that you don't
right,
even
because
consume. So you're like, oh, no big deal.
yeah, and so right, I've heard right with leaky gut, often you have reactions to foods that you eat a lot of, and for me, like I didn't have reactions to beans, milk, dairy,
Yay. You
any
didn't
of the
have
things that I,
those, the
typically
big
eat.
ones.
Yeah, level 3, the next level is benzoic acid. So benzoic acid, sodium benzoate, and there's another name too, but like it's a preservative. It's
Yep.
used in like salad dressings. It's used in a lot of commercial or a lot of energy drinks as well. That's what I
Yep.
noticed.
Benzoic acid makes things shelf stable. They can be on the shelf at a store or in your pantry for months and months. And so benzoic acid is, one of those preservatives. And again, we see that in processed foods. So
Right.
things that come in a box, things that come in a can, salad dressings, that preserve the shelf life of that food so that it's not going to spoil as quickly.
Brief interrupt. Our internet connection dipped and I lost about 5 minutes of audio here. We were talking about my specific food sensitivity results and why I might have them. Seriously, why did garlic, black pepper, and spinach show up, whereas dairy, wheat, nuts, beans, soy, etc. did not? For me, my sensitivities might have been related to my H. pylori infection. This is common, especially for people who have lived overseas. It caused gastritis and eroded my stomach lining. Stress might have also contributed. We talked about how to interpret these results along with the biomarkers for leaky gut. My test also included 4 of those biomarkers, and then there's further tests that can enlighten more. So it's complicated, and that's why it is often worth having someone who has expertise guide you through this process, like Dr. Bree. Back to the show. So, what are some common mistakes people make when they try to fix their own gut health?
Number one, like I mentioned, it's only changing their diet alone or trying to seek improvements with just taking more pills, more supplements, kind of guessing what they
Right.
might need. And this is where objective data, test, don't guess, comes into the equation.
Mm.
So if you've tried a probiotic or you've said, hey, you know what, I'm going to cut out dairy and see if it makes any difference, and it's helped, fantastic. If you've done different things and you're still not getting results, you're not feeling improvements, this is then where you seek out, some additional help and intervention. But there's lots of different things. Like I said, trying some probiotics, trying some digestive enzymes. As we get older, we lose stomach acid, we lose pancreatic juices. And that alone, older than age 50, that alone can make a difference in a lot of people. Sometimes patients are taking medications that are causing problems for them. And then talking with their prescribing doctor
Mhm.
on whether or not that's, are there alternatives? Even talking with their pharmacist to see if there's alternatives, if that medication might be part of the problem. So there are many, many really, really good books that are out there. So there's many great podcasts. One of my favorite podcasts, and I have no financial investment in this
Yeah,
podcast, it's called The Turd Nerd.
it's for nerds.
It is a functional medical doctor and then 2 naturopathic doctors, and they talk about data, and it's for educational purposes, so people can start to understand what's going on for their bodies and then take that to their provider and say, "Hey, I'm wondering about this. I
Yeah.
think I'd like to have this test done. Will you order that for me?" So podcasts can be an educational resource for lots of people to try to understand what's happening for their body and advocate for themselves in working with their providers.
Very cool. Um, any myths you'd like to clear up?
I think we kind of touched on that of like, carbs are bad.
Yeah.
Um, that's not entirely true. Yes, making changes to your diet. Yes, figuring out what foods work for you, what don't work for you. It's a lot of trial and error for some people that, an all or none dietary approach generally does not result in improvements. It might be temporary. Whenever we have extremes, the body wants to be in homeostasis. It
Mhm.
wants to be in balance. And if you are not in balance and we're doing extreme diet, extreme fasting, you know,
That's contribute to stress
anything
too.
extremes generally does not allow the body to go back into balance. And it's also not sustainable. So the myth of doing a dramatic, prolonged, extreme dietary change or, taking 20, 30, 40 pills per day typically is also not beneficial. So that myth of, you can figure it out by just changing your diet alone generally does not hold water long term. It might help for a few weeks, a few months, but long term, there are generally other things going on.
What is the price range of lab tests so people know if there's any side effects? Like, I'm trying to think. I ordered mine for my health care, and I think it was 400,
That's a
somewhere around that
fairly
range.
typical price. So, like the food allergy finger poke test that I talked about, the patient price is $239 for 144 food
Okay.
items. The stool test that I use through these two different companies ranges right at about 400 or 25. Um, you know, Health savings accounts, flexible spending accounts, those types of funds can be used to pay for it. Insurance typically does not
Right.
cover those, so be prepared to pay out of pocket. In terms of, seeing a functional medicine provider or a naturopathic doctor, uh, that first hour new patient visit can range 250 to 400 is typical, maybe a little bit more, for an hour visit. And in my practice alone, I'm a cash practice. I don't bill insurance because most insurance carriers don't cover naturopathic care, which again, this is where health savings accounts, flexible spending accounts, deducting your medical expenses on your taxes
Mhm.
all comes into the equation. Using your PFD, if that's part of, what
Right.
Alaska residents might need to do.
Right. I
Um,
mean, yeah, I feel like health is something you have to invest in too,
Correct.
no matter what. It's gonna cost some money to take care of yourself, and it's either yourself now,
Or
like
pay the
deal with
price later.
consequences.
In
So
my almost 24 years of practice, I've had kind of a mantra of respect patients' time, respect patients' intelligence, and respect patients' budget. So I strive to make things affordable, testing, office visits, treatment, things like that.
very cool. Where would people find you and work with you? They're interested.
So I am just starting to get my Alaska practice kind of up and running. It's called Northern Lights Natural Medicine. The website is nlnm.info. And you can find me online.
Very cool. And then for you, why is it so important for you to stay healthy as it is? Take care of yourself, take care of your gut, take care of your hormones. We're gonna do another one on hormones with Dr. Bree.
There'll be more to come because I want to be able to carry my own groceries into my house, when I'm years old, because I want to enjoy my kids. I have 2 kids. If they ever have children, to enjoy grandchildren. I wanna be able to play outside. I wanna be able to go on adventures. I wanna be able to travel. I wanna be able to provide health care in my practice for as long as I want to work. And I wanna be able to enjoy every single day and not feel like I'm suffering and miserable or have fatigue and headaches and tummy troubles. I want to be able to thrive in my day-to-day life instead of just exist.
Awesome. Thank you so much.
Thank you, Dr. Luro.
Thanks for listening to On the Ascent Health. If you enjoyed today's episode, make sure to subscribe so you don't miss what's coming next. And if you found it helpful, share it with a friend and leave us a review. It helps more people discover the show. The views and opinions shared by guests on this podcast do not necessarily reflect my own or that of Ascent Health and Performance. The information provided is for educational purposes only and should not be taken as medical advice. Next week on the Ascent Health, we're talking menstrual cycles and hormone rhythms with Anne McCleary, why your body changes week to week, and how supporting those natural fluctuations can actually help you feel stronger, more balanced, and more in control. Until next time, onwards and upwards.